In the parable of the Good Samaritan, Jesus taught us that we are called to reach out and lift up those who are suffering. This concept is core to our mission. And our proposal is based on the values of hope and dignity of the person. The problem we are addressing is the opioid crisis. While many factors fuel the opioid crisis, the biggest factor is poverty. One of our responses to the crisis has been the creation of a certified peer recovery coaching program. Experts have found that peer recovery coaches are crucial to helping those in recovery break the cycle of poverty and addiction. Imagine if we could implement something like this nationwide, empowering individuals and communities to conquer addictions and to live life more abundantly. This is the Max Kolbe program.
Max began in 2019 as a response to the high number of people in poverty who are entering the emergency departments for overdoses. As a coach, I meet people in crisis and I mentor them through the process of recovery. I'm there for them, whether that's finding stable housing or needing a ride to an appointment. Clients trust me because I've been there. I'm a real-life example of that recovery is possible. My clients have gone from living on the streets and without income to living in their own apartments with employment, and some are even interested in becoming coaches now too. Max supports coaches and their professional growth. I've even become a supervisor.
Our program is different than a traditional recovery coach program. At Max, we prioritize our coaches in their recovery. We educate and train them to go into any environment confidently. They could go into an emergency department, a courtroom, or meet up virtually. Our clients and our stakeholders have expressed the needs for enhanced recovery support, meaningful employment, and an immediate response to overdose situations. Inspired by these needs, we are proposing Max, a research-driven, evidence-based website that any agency can access and implement in their own community.
With this grant, we will partner with the university research team to help us further develop existing documents for expansion into multiple counties. The data collected will be used to support the website content, which will include a training manual, videos, sample contracts, and online support. Our peer advisory committee, composed of clients, coaches, and community partners, will complete surveys and focus groups to answer the question, what works to get people out of the cycle of poverty and addiction? In supporting our proposal, you can be confident knowing that Max is backed by statistical evidence and stakeholder involvement.
Our goals are to improve the quality of life for individuals and communities by investing in staff, training, and research. Short term, we'll expand into 2 counties. We'll grow our workforce by adding 100 peer supporters who will serve 1,000 clients. The expansion will provide us with data necessary to successfully implement Max on a national level. Our medium goal will use the evaluation results to develop and launch the website for other Catholic charities. Long-term, Max will reduce addiction and poverty across the United States. It will also create a culture shift which will change the way communities view recovery. The award dollars will focus on the creation of a website and research, since the program utilizes a self-sustaining model of Medicaid billing. Any agency can implement Max using their own behavioral health staff. There's also national and governmental support for these programs, such as SAMHSA funding for certified coaches and United Way strategic initiatives.
COVID-19 is on everyone's mind right now. The pandemic has caused an increase in overdoses across the country. Yet thankfully, Max has been able to continue with minimal adjustments. Our coaches use telehealth to meet with clients and continue going into ERs using PPE. Unfortunately, people suffering from addiction and poverty often face racial injustice and inequality within multiple systems. Max addresses these injustices with a diverse and bilingual staff, training, and community education on implicit biases.
For over 70 years, Catholic Charities has accompanied thousands of God's children on the road to recovery. We have successfully expanded our substance use disorder programs in 8 counties, serving diverse populations in both urban and rural areas. Since Max began just 18 months ago, we have served over 1,000 clients. We've created collaborative partnerships countywide. Max breaks the cycle of poverty and addiction. Let us help you implement this in your community. Together, we can save lives.